Giulia, I do apologize. I do hope that I got your name as close as possible to how it's meant to be pronounced. But on a serious note, this study by the World Health Organization pretty much confirms what we've suspected all along, doesn't it?
Yes, absolutely, Tula. As you said, it is what we actually know in a way. It's just confirming it. But this period of the pandemic has really stretched people in so many ways, emotionally, socially, economically. And so the signs are things like anxiety and depression increasing. And the WHO study also showed that the impact on young persons and women was particularly harsh. A higher incidence of suicidal behavior and self-harming was part of what the study revealed.
Do you have an idea why those segments of the population would be affected particularly severely, young people and women?
Probably with young people, they are at that age where they are really peer-orientated. They need their peers, whether they're at school or college. It's such a big part of their orientation in life. And when that falls away, it's a huge chunk of their social interaction that falls away. So, and women, probably because also services, healthcare services, mental health care services were also compromised during the pandemic. And women found themselves having to be caretakers, educators, disciplinarians, breadwinners, so many things all wrapped into one. And that does take a strain on any person, no matter how amazing you are as a woman or a mother.
Yeah.
I think any person would take strain under those conditions.
So there's an observation that suggests that exhaustion, just sheer exhaustion, we don't think of it that much when we're thinking mental health. You kind of think of the other things, isolation, loneliness, and the fear of being infected yourself, grief, etc. But exhaustion was a big factor. Yes,
and I think, Tula, the exhaustion is also on a mental and emotional level, not just physical. Exhaustion on all those levels. And remember, when we are chronically stressed, the adrenal glands are producing adrenaline, noradrenaline, and cortisol on an ongoing basis. And eventually you get adrenal exhaustion, where your body just can't keep up. And also insomnia. Chronic insomnia can also lead to exhaustion. And that can happen so easily when you go to sleep at night and you've got all these thoughts and fears going on in your mind. How are you going to pay the bills? What's going to happen tomorrow? There's so much uncertainty. So chronic insomnia can also add to that level of exhaustion. And I think in some way, there is really no end in sight. It's not like we're going to go back to how it was. Things will probably never be the same again. And so we're having to reorientate ourselves to a new way of being, where maybe we have to come back to living for each day and not thinking about tomorrow or the next day or next year.
We talked a lot at the height of the pandemic, Giulia, about underlying conditions. I'm trying to remember the exact phrasing that we used at the time, but nevertheless, such as asthma, cancer, heart disease, etc. I didn't necessarily make the connection between that and the incidence of mental health challenges. What's the study telling us about that nexus?
Well, what the study actually showed was that people with those conditions, asthma, cancer, and heart disease, they were actually more likely to develop mental disorders. And so that came up in the study. And probably because comorbidities was a big focus when COVID was around in the beginning. Comorbidities, people who had heart disease, obesity, asthma, they seem to be much more vulnerable to getting sick with the virus. So I think, it's a whole combination of what we get told in the media, this whole thing of fear, anxiety, really adds a lot of fuel to the fear story in anyone's mind. So I think that's also part of it. And that's why it's so important for us to take time to take care of ourselves, disengage from social media for a while and go and spend time outdoors in nature, walking, taking healthy supplements where it's appropriate, like ashwagandha. We need to take our power back and do what we can to take care of ourselves. And there's a lot that we can actually do.
Yeah. All right. Thank you for that, for your time and your insights. And thank you for adding also what we can do and always focusing on the issue of mental health and focusing on our wellness and taking what steps we can to help ourselves out in these trying times.